Hi, and welcome to Medicare Basics Workshop. I'm Cheryl Scarlato, and as we will spend a few moments together going over some basics. If you're starting Medicare in the next 12 months and you're not sure where to begin, this workshop is the best resource and it is free to help you learn the basics of Medicare. So, who is this for? Ideally, this is for people that are 64, getting ready to go on Medicare in the next year, and for people on Social Security disability. This is not for military retirees or for federal employees. We have resources for you specifically. So in our workshop, we're going to teach you all about Medicare. When you sign up, where to sign up, how to sign up, approximately how much it's going to cost you, and we're going to go into the dark side of this, and that is the Medicare late penalties and how to avoid those lifetime late penalties that can really catch people by surprise. But first, a little bit about us. We are really unique. We are a married couple doing business together. I'm Cheryl Scarlato, and as you can see in the picture, my husband Frank Scarlato. We started this journey about 12 years ago as our second career going into retirement and helping others transition into their retirement years. We are licensed in 10 states and can add other states with your referral of a friend or a family member. We can help you wherever you live, and our service is free. So government Medicare has two parts. There's Part A and Part B. Part A is basically everything that happens inside of the hospital. Part A also covers hospice care and some nursing care. And Part B is everything outside of a hospital, like your doctor visits, labs, x-rays, oxygen, hospital beds, some preventative services like colonoscopies and mammograms. So Medicare Part A is often misunderstood and that it is free. Well, it is not free. You paid for Medicare Part A through your payroll taxes. So if you or your spouse worked and paid payroll taxes at least 10 years, when you get ready for Medicare, Medicare Part A is paid up. It's not free. You paid for it. And there are people that didn't work 10 years or didn't pay payroll taxes for 10 years, so they have to pay for some or all of the cost of Medicare Part A, which can be very expensive. Medicare Part A will not come with a monthly cost, but Medicare Part B will come with a cost. So, everything Part A, again, it covers everything inside the hospital, but you have a deductible. And that deductible will go up every year. And for 2024, it's $1,632. Now, that is basically per time you are in the hospital. It's not an annual deductible like you had when you were working. If you had an employer plan of an employer health insurance, you had a one-time deductible for the year. Once you met it, you were done. Not so with Medicare. You could hit this 3 or 4 or 5 times a year. Most people aren't prepared for it. If you are in the hospital, Medicare can pay for the first 60 days. And after that, day 61 plus, you have to pony up, and that can be extremely expensive. Medicare Part B, which is something that you're more familiar with because you got to pay for it. And you have heard from your friends that you have to pay for Medicare Part B. So how much you pay is dependent on how much you earned. So the majority of people, over 90% of people on Medicare in 2024, will pay $174.70 a month. But you might be a high earner and you might pay $200, $300, $400, even $500 a month for Medicare Part B. It's based on your modified adjusted gross income from 2 years ago. So it can be an I gotcha when you're going into Medicare thinking I'm going to pay $175 that your friends are all paying, and then you find out, no, you're paying a lot more than they are. Well, because it's based on your income from 2 years ago. So Medicare Part B, you're going to pay a premium for. That's also people that are low income that get help from their state. They're going to get help paying for their Medicare Part B, but the vast majority, like 90% of people in 2024, will pay that $174.70 per month. The Part B deductible is $240 a year. So before your Part B kicks in, you pay that one-time deductible. If you are on Social Security, they automatically take that out of your Social Security check. If you're not on Social Security, it's a little bit more complicated, and you will pay quarterly, and they will send you a bill. What does Medicare B cover? So I simplified it a little bit. I already said it covers everything outside the hospital, your doctor visits, preventative services like mammograms, colonoscopy, your PSA flu shot, the COVID shot, a shingle shot, durable medical equipment that you might need, like a hospital bed or oxygen or a cane or a walker, MRI labs, x-rays. So all of those things that happen in an outpatient setting outside of the doctor's office, Medicare Part B, you pay monthly cost and it has a deductible. So if you only have government Medicare, you're going to pay 20% of all of the costs of Medicare Part B, and then government pays 80%. So Medicare is an 80-20 plan, and that's a good deal. Your 20% doesn't sound so bad unless you realize that it's unlimited. 20% of a huge bill could leave you out of pocket $5, $10, $20, $50, $100,000, and we've had clients with that very same scenario. So let's put it this way, and I don't like to scare people, but I do want you to know that government Medicare, I would never consider it to be enough coverage that you want to find something to supplement it, because there are so many holes in government Medicare. And one of those holes we're going to be talking about in the original Medicare Part A and B, and the hole is that 20% that you have to pay. Think about it. If you had cancer and you had to pay 20% of every chemotherapy treatment, every radiation treatment, if you had dialysis, if you had to pay 20%, you can see how that can really rake up some huge bills very quickly, because you might be getting several treatments a week, 4 weeks, or months, or even years on end. So that is a huge hole that we want to help you be aware of and to ideally plug. Medicare prescription drugs. Your Medicare prescription drugs in general are not covered by Medicare Part A and B. You have to buy a separate private insurance plan through an insurance company, and that is called Medicare Part D, as in dog. You'll get your drugs privately. Now, there are some drugs that are covered by government Medicare by your Medicare Part B, but like I said already, you have to pay 20% of those drugs. You can imagine that those drugs are probably pretty expensive drugs, and they're typically drugs for like rheumatoid arthritis or Prolia, and there's really expensive injections for osteoporosis or chemotherapy drugs. There are infusions given to you inside your doctor's office. Those are covered by Medicare Part B, but you have to pay 20%, and that 20% can be thousands of dollars a month. Medicare A and B also does not cover any dental. And you ask, what about cleanings? Nope. What about the exam? Nope. X-rays? Nope. No dental whatsoever. None. Zippo. It will cover some vision, cataracts, macular degeneration, glaucoma, but it doesn't give you a well eye exam, which is what you need to discover if you have any of those issues. It covers no hearing. And you know hearing aids can cost thousands of dollars. The price has recently come down, but Medicare doesn't help you at all with the hearing exam or with the cost of the hearing aids. Medicare doesn't cover anything cosmetic or anything that they deem that's not medically necessary. So, in summary, and you've made it this far, Part A is everything inside of the hospital. No premium for most people. And Part B is everything outside of the hospital. You will pay a premium for that, and most people will pay about $175 a month for this year. And there's lots of stuff that Medicare does not cover, such as that 20% cost sharing, your deductibles. It doesn't cover dental at all. It doesn't cover a well eye exam. It doesn't cover any hearing. Doesn't cover any prescriptions outside of the hospital, and nothing cosmetic or deemed not medically necessary. Now, if you're like, I've learned enough and I don't want to continue with this workshop, you're like, I just want to talk to you privately about your private situation, well, that's fine. You can do that. Below this video, you can book your own appointment with me. There's no obligation, there's no fee, and we are licensed in your state. But if you have the stamina to continue on, let's go. Let's talk about your options at covering that 20% that you are exposed to. So, you know there are a lot of holes in the original government Medicare, and that's why most people in the country buy something to supplement it to fill in those holes. And you have two options. You have a fork in the road. You can buy a Medicare supplement plan, also called a Medigap plan or a supplemental plan, and you will pair that with the government Medicare. Or you can leave original government Medicare and just go into private Medicare. Private Medicare is also called Medicare Advantage, like your PPOs and your HMOs. So you got two ways to go. This is really important decision that you have to make because it might be a lifetime decision that you cannot go and change later. So let's start with Medicare supplements, otherwise known as Medigap plans. So let's start with the Medicare supplements. They're all, as I just said, they're also known as the Medigap plans. It is a supplement to your government Medicare. You're going to stay on government Medicare A and B, and then you're going to buy a private insurance plan to fill the holes in government Medicare A and B, and then you're going to buy a private insurance plan to fill in the holes in the government Medicare A and B. What's the good thing about Medicare supplements? The best thing about it is you can see any doctor, you can go to any hospital in the country, so you have complete flexibility. That's really the part that's most attractive to people. It fills in the gaps of original Medicare so that you have a lot less out-of-pocket risk. You know more of what you're gonna be spending. It is a plan that is standardized, which means if you buy a Medicare Supplement Plan G from Aetna, it's going to be the exact same plan from any other company. A Plan G from Aetna is the same Plan G from Cigna or Mutual of Omaha or Humana. The only difference is the price, is the premium. Your benefits are not going to change. As long as you pay your premium every single month, they cannot ever change it. You are guaranteed to be able to renew that plan for the rest of your life. And you'll see, I'm going to contrast that with private Medicare, which can change every single year. Now, if you buy a Medicare supplement plan, you will have to buy a drug plan separately. So let's look at all the plans that are available. So this is a standard chart. This is the same for every company. They have to offer the exact same benefits. So if you're looking at a Plan G that is considered the Cadillac plan, that is the most popular plan sold in America right now. Why is it a Cadillac? Because it provides the most coverage, and that's what most people that are new to Medicare are going to lean toward. So looking at this chart, there's only one hole in it, right? That is your Part B deductible. And this year, it is $240, which changes every single year. So once you meet your deductible, which is generally your first office visit or maybe 2 office visits, then for the rest of the year, you have no out-of-pocket expenses. You're not constantly writing a check. You pay your monthly premium and that's it. So you can see Plan G has the best coverage except for Plan F, and Plan F is no longer available for sale. 2020 was the last year you could opt into it. But people who already have a Plan F, they are grandfathered in and can keep their plan. And if they are eligible, they can change their company to a lower cost company and still have their Plan F. But people new to Medicare no longer have the option to buy Plan F. So you can see there's lots of different plans in your state. You may have 30 different companies. Every state offers different plans with different pricing depending on where you live. To be eligible and approved to buy it, there will be health questions the companies will ask. Every company has different questions. For example, in the last 2 to 5 years, have you had cancer? Have you had a heart attack, COPD, rheumatoid arthritis, stroke, etc.? And do you have any pending tests? Has the doctor told you that they are going to watch anything? If you say yes to any of these questions, in most cases, you're not eligible to buy a Medicare supplement, with one exception. When you first enroll with Medicare Part B, they have to take you. There is a one-time window of guarantee acceptance. All companies that offer Medicare supplements, they have to take you. You ask, what plan? Any plan. They are not allowed to ask you any health questions. That is very important because if you miss this enrollment window, they will ask you these health questions. And if you say yes to any of the questions, you might never be able to buy a Medicare supplement for the rest of your life. That's why it's so important that you understand this before going in. So back to your options. When you are first eligible for Medicare, these plans are also known as Medigap. All of the plans I showed on that chart, most people opt for Plan G or Plan N. And we can discuss your personal needs and options on our discovery call. So, your second choice, the other fork in the road. Your second choice is you can opt to leave original government Medicare and go into private Medicare plan. Getting your Medicare Part A and B and the supplement and the drug plan all rolled into one. And that's called Private Medicare Advantage, also known as Part C. So, what is Medicare Advantage? The thing that makes it really attractive is that it often has a very low to no monthly premium. It is also available to you based on the county that you live in. Yes, you heard me right. All the way down to your zip code, your county. So your sister that lives across the street might be in a different zip code. She's going to possibly have different plans available. She may not have a zero premium plan that you might have. She might have several zero premium plans. And the next county over might have a cheaper plan, but that plan has a $60 a month premium. So like I said, it can change every year. Unlike Medicare supplements, which are not allowed to change. That low to no premium plan is attractive to a lot of people. And a lot assume that it is free, but it is not free. You have to be enrolled in Medicare Part A and B, and you still have to pay that monthly Part B premium to be eligible for Part C Medicare Advantage plan. The other big difference between Medicare Advantage Part C and a supplement is the network. You are confining yourself to a network of doctors and hospitals. And the network might be huge in your state, or it might not. In your state, it might include all the major hospitals, or it might be small. But you're okay with it. It's because it encompasses all of your doctors, versus there are no networks with Medicare supplement. Medicare Advantage Part C may have no premium versus having a premium with a supplement. Another benefit of a private Medicare Advantage plan is it usually encompasses the drugs. So the Medicare Part D drug plan is enrolled into your health plan. These plans do change every year. It is a yearly contract. The private insurance companies can add, they can take away any benefit they want. Doctors can jump in and out of the network anytime that they want. They can change your benefit, like your dental benefit or a gym benefit. One year you may have it and the next not. So if you don't like change, I always say, if you're not flexible, you may not be a good candidate for a Medicare Advantage plan, because it will change each and every year in price, in copays, and sometimes in all the extra benefits. You may need a referral to see a specialist, or you may need pre-authorization or permission from the insurance company to have a procedure done. Medicare Advantage is managed care. So when leaving original Medicare and opt to go with private managed care, the decisions are now the insurance companies and not your doctor. And something to consider in your decision: the exposure to that 20% that Medicare does not cover. Medicare Advantage does not cover the 20% of some cancer treatments. You may want to consider your family history or your current past situation. There are ways we can help protect you from that gap, but again, we can discuss your options in our discovery call and what your needs are. And you all know about those extra benefits. Only people that do not watch TV every day, people don't know about those extra benefits of the people who don't watch TV and seeing all those TV ads during the months of open enrollment. Open enrollment is October, November, and December. These ads are running non-stop. They talk about the grocery cards, the flex cards, utility bills, pest control, food for your service dog. They go on and on. And they can offer dental benefits that original Medicare does not. They also can offer vision and hearing aid benefits. Some offer transportation to and from the doctor or your pharmacy. Some will offer a free Lyft or an Uber ride to a limited amount each year. And there are plans that offer meal cards or a certain amount for groceries, and some offer meals after a surgery. And some by just give you your money back to help pay for Medicare Part B. But these benefits are offered per county, and they may not be offered in your county. So those ads are very misleading. The companies pay for those ads nationwide. So that's why it's important to contact us. We do the research of what is offered in your zip code and what is available this year. So, what is better? A Medicare supplement or a private Medicare Advantage plan? Well, tell me about your budget. A supplement gives you the flexibility to see any doctor, any hospital in the country. A lot less red tape and a lot more flexibility. The Medicare supplement will start at a higher price and will go up a certain percentage over time. But how about if you're healthy and you never go to a doctor? Then it's something to consider. So let's discuss your health. How often do you go see a doctor a year? How often do you travel a year? Do you like change? Medicare Advantage changes every year. Medicare Advantage, you will be confined to a network. How many doctors do you have? Let's talk about genetics. Family history can play an important role in your decision. Do you have any upcoming joint replacements? So where do you start? And what is the best plan for you? This might be very different even from your spouse, from your sister, your cousin, your neighbor. So where do we start? After we've discussed your options, your budget, your health, let's look at this pyramid. It's easier to start at the top because everybody qualifies for a Medicare supplement. When you first enroll into Medicare Part B, regardless of your health, they gotta take you. But if you start at the bottom of the pyramid at a private Medicare Advantage, they have to take you too, regardless of your health. But if later you want to go up the pyramid to a Medicare supplement, you have to answer health questions. So if you're not healthy when you first enroll into Medicare, you may want to get a Medicare supplement. So if you can comfortably afford it. Not everybody can. A Medicare supplement, I would like you to start there. Even though you know the premium will go up, they're going to go up about 5-10% every year or every few years. It depends on the company and the plan. It also depends on the risk pool of that plan. That's just medical inflation and regular inflation at work. So if you bought a plan and after several years of premium increases and it's getting tight on your budget and you're on a fixed income, you have the option to shop around for a lower premium plan with a different company. So long as you can pass the health questions, you can change at any time of the year. Or you can opt to go into a Medicare Advantage plan because they have to take you regardless of your health. But you may be locked into that Medicare Advantage plan if your health is such you can no longer pass those health questions of a Medicare supplement. You only have a certain window during the year when you can go into a Medicare Advantage plan. Outside of your guarantee issue window, that is between October 15th through December 7th of every year. You just have to be aware of that window, but don't worry. We will keep you up to date if you are on our email list or you follow us on our Facebook page. With a private Medicare Advantage plan, once you enroll in a Medicare Advantage, you do have the option to go back to Medicare Supplement if you can answer those questions. I have people that move around, I wouldn't say all the time, but they do move around. They are healthy and they want to save money, and it's based on their budget, their zip code, and the risk that they're willing to go into. Do not make a decision based on what your neighbor or your family member has, because every person has different needs, your health, your doctors, your medications, and yes, your zip code. These are all critical deadlines around this. You have a 3-month window before the month you turn 65, the month during your birthday, and 3 months after. And in that 7-month window, you need to make these critical decisions. If you mess up these deadlines, you might end up with a lifetime penalty, a lifetime late Part B penalty, which is 10% of the monthly premium. You will pay that every month for the rest of your life. So we said that this year it's $174.70. You would pay an extra 10% a month on top of that. And Medicare Part B goes up each year, and so does that 10% penalty every year. It will follow the current year premium, and you will have a late Part D penalty, as in drugs, your Part D penalty. You can have 2 penalties because you are 1 day late. We want you to avoid these penalties at all costs, because these penalties don't go away when you reach 70 or 80. These are lifetime penalties. So let's avoid them at all costs. Even if you're still going to work past 65 and you're eligible to stay on your employer's health plan, you still may want to go on Medicare. Now, you don't have to go on Medicare, but by law, you don't have to enroll in Part B if your employer has over 20 people on the group health plan. Some people hear that and they stop listening right there, and they're like, oh, okay, I don't have to. Great. Now, you don't have to, but you might want to go on Medicare if you do a comparison. You might find out, because most people are surprised to find out, Medicare is often a better than their health insurance at work. There's a lower deductible, a lower monthly cost, lower copays, but you won't know until you do a comparison. So even though you want to continue to work past 65, we want to talk to you about your options at work, for you and for your spouse. Medicare might be the better option. But what do you do next? A lot of people say, can you help me? Well, of course, that's what we do. We've helped people all across many states. We've been doing this for over 10 years, and we've loved to help you. So if you're ready to go on Medicare in the next 6 months, just pick a date on our calendar below this video, book an appointment that is convenient for you, and we'll talk about you and your unique situation. This is not a cookie cutter situation. We customize based on your needs, your health, medications, your doctors, and your budget. And whether you're going to continue to work or not, or whether your employer has, whether you have 20 employees or more or not. And then we are going to pick a plan you're most comfortable with. There is no best plan. We are not pushing a plan. We don't work for the insurance companies. We work for you. We represent the top rated companies, and we're going to help you make an educated decision. And oftentimes that decision will change every couple of years. So schedule your own appointment on the link below. We would love to help you and your family. In the meantime, add our contact information into your phone and download the Medicare app called What's Covered. That is on your phone. It's an app. You can look up a procedure on the app and at your fingertips from your phone, and look to see what Medicare covers. It's free to use, and we look forward to working with you.